Hi, I'm Deb Corring, one of the clinical directors at St. Joseph's.
And I'm Cameron Shantz. I'm a principal with Parkin Architects.
Cam, it's so exciting to be here today. I can remember back to our conversations about what we wanted this building to be like, to support our recovery-oriented approach to care and bring lots of dignity and hope to the people that we serve.
We certainly were trying to create a building that was different than what one normally thinks of as a facility to support people with mental illness. And we're pretty happy with what turned out here. So in the building, we were trying to support the recovery model that you use as a clinical practices and create spaces within the building that would support what you're doing for the patients in helping them to recover and eventually to be able to move back into the community. So we really developed the concept for the building around the whole notion of having a house or a home environment that can support people in their kind of personal spaces, extending that into the neighborhoods where there are support facilities, group rooms, and so on, and then eventually to a downtown, which really conceptually represents the community. We've introduced things like cafeteria and small stores and so on that patients can kind of model those activities that they're going to be eventually having to experience when they get back into the community. So we're really trying to focus the different areas in the building to support privacy, education, skill building, and social interaction.
Yeah, absolutely. And the design of the house, where they have the privacy of their own bedroom, where they have the privacy of their own ensuite washroom, is fabulous, but it's still allowing enough space in the house for that social interaction. I'm thrilled with what we'll be able to help our patients with. The simulated apartment will go a long way in that regard.
We really wanted to introduce a lot of natural light into the building. It really supports people on an everyday basis. And so what we've done is we've introduced 3 major courtyards into the center of the downtown building. And so it brings that natural light in and that kind of calm feeling, the feeling of nature and natural light right into the core of the building.
Even on a cloudy day, it feels bright and light in the building.
It's a fairly large building, and by introducing the courtyards into the center of the building and bringing that natural light down, everything really works around those 3 courtyards. And part of that was also a strategy in the development of a LEED Gold certification for the building.
Not only do we have a beautiful building, it's environmentally friendly.
Absolutely. Part of the whole approach for LEED is to develop a holistic building and look at all aspects to support quality and character of the space and environmentally sensitive environment. So we've done a lot of things within the building to be very efficient with the use of energy, with the use of water resources, and even as simple as introducing motion sensors on lighting so that if you leave a room, the lights will automatically shut off.
Everybody remarks on the colors, the use of color, and how wonderful that is. It makes it feel warm and inviting.
We work very hard on developing the color palettes for the building. We use them as wayfinding elements within the building so that we were able to kind of identify one wing of the building with kind of blue colors and the other wing with green. And then we developed the palettes within them to have colors that were warmer, more kind of lively, so that it wasn't kind of a drab feeling.
Ontario started looking at the way mental health care should be delivered some time ago. The concept of people being in hospital for shorter periods of time, people receiving care closer to where they live as opposed to having to travel several hours as we've had in the past, and getting better in caring environments is all part of it. So in addition to you helping us build these wonderful new buildings, we've been transferring beds to 4 other communities. But in the meantime, there are people in Windsor and Kitchener and Hamilton and St. Thomas who are able to receive their mental health care. People come, they're in a great caring and healthy environment. We do lots of skill building. We make sure they're feeling comfortable in social settings and manage the illness that they're dealing with and get them back home and back to the community where everybody wants to be. So Cameron, let's go take a look at how your wonderful concepts came into reality.
Absolutely, let's go.